How will COVID change India? Amid the steady rise in confirmed cases comes a true test of resilience. We'll ask about the fight against the unforeseen pandemic, in both cities and those all-important rural areas where two-thirds of Indians live. It's all about lives and livelihoods. What's changed since last March's sudden lockdown, which left at the time day laborers scrambling and an already slowing economy reeling? No choice but to get back to work. This Monday saw the reopening of the metro in Delhi and other major cities. The notable exception of Mumbai. We'll ask about the mood and more broadly, the lasting impact on India's social fabric. Do citizens expect more or less from their government and from each other? What of this change will be permanent? Today in the France 24 debate, we're asking what India after COVID. And joining us from Mumbai, Siddharth Bhatia, founding editor of the Wire.im. Thanks for joining us.
Thank you.
Here in the studio, we're with Pradeep Singh, commentator and supporter of Narendra Modi's BJP party. Thank you for joining us here in the France 24 debate. And Leela Jacinto, who cracks the whip at France24.com. Thank you for being with us. We'll be joined shortly by from New Delhi by Ramanan Laxminarayan, founder and director of the Center for Disease Dynamics. The France 24 debate on Facebook and Twitter. The hashtag is F24debate. Let's begin with, the latest news of India passing Brazil as the country with the second most cases in the world. The numbers are indeed rising, starting in the south, in Maharashtra state, in places like Pune and Mumbai, where you are, Siddharth Bhatia. The number of confirmed cases rising, what does it tell you?
So, obviously, this needs to be kind of sliced and diced. Mumbai is a very, very densely packed city. Surprisingly, in some of the slum pockets, we've seen a herd immunity. But people have started coming down. The lockdown has not been lifted. Trains are not running to their full capacity. Passengers are not being allowed to travel by trains unless there is urgent work. So, but when you have such a densely packed, it's an island, it's 7 islands stitched together. When you have such densely packed areas, 20,000 cases yesterday, I think it rose by. So it's not surprising at all. And I mean, now they're talking about herd immunity kicking in December, Jan. But it's not surprising at all because people are going out. And you can't stop people from going out because I went to the market the other day and there's tons of people in a small crowded area selling on the street. And quite a few were not wearing a mask. So you can't stop livelihoods,
Really,
So
because,
in a
because
way,
let me ask you about this,
understandable.
Siddharth. Let me ask you about
And
this.
suddenly we've seen.
Let me ask you about this because our correspondent in Delhi, Mandakini Galat, said that she was actually pleasantly surprised by the high number of people who were wearing masks in the capital. You're saying in Mumbai it's not always been the case.
No. I wouldn't like to extrapolate from that one incident. But yes, I went to a crowded street market and a lot of people weren't wearing it. So, these things are happening. It's in full view. It's in the afternoon. The municipality and the police have been very, very strict. They go around looking at people, fining them, etc. But how do you find a small area where there are something like about 500 to 800 people, 750 with customers, and people buying vegetables, etc. How do you go around insisting everyone does it? So now this kind of thing is also happening, and of course there are a lot of responsible people who are wearing a mask. My point I'm trying to make, the bigger point I'm making is, though the lockdown has not been fully lifted, economic activity has begun, especially informal economic activity, not in the offices, and there it's happening. So, it's not surprising that it's going up. Incidentally, for the first time in about a month, for 2 days running, Mumbai is showing signs of a severe crisis in ICU beds. And that had kind of slowed down. They were available, and now again there is some stress about that. So it's kind of tapering off, but still rising. 20,000 cases yesterday.
All right, hospital workers who've been at it since March and say they're getting tired, taking it as a hard blow. Let's take a listen.
See, some bit of rise would have happened, but the rise is more than what is expected, and I think there it is we as people who are also significantly there to blame. We have become careless.
We have become careless. Full disclosure, we're talking about your native city here. What's your reaction when you hear that, Doctor?
Well, I have been in France through all of this, and I see the stress in my loved ones. They have been living 6 months. First it was a very tight lockdown. There is, a sense of fear, as Siddharth Bhatia said. It's a very crowded city. There are the obvious problems that everybody foresaw. So, so I see Bombayites in a period of stress where in Europe we seem to have come out of the worst of it. There's always the fear of whether we are going into a surge, a resurge. Yes, of course, the cases are rising in France, but there's panic, and things happened a bit differently in India because the lockdown, as we've been discussing this, was extremely tight. It was among the strictest lockdowns, clamped down at 4 hours notice. But what happened in India, what I sense is that the fear started giving way to some form of stigmatization. So in Mumbai, for instance, there are these fears if there is a COVID case in a building society, or, will there be a stigmatization? So it went into that. And very early in the pandemic, too, there was stigmatizations of who are the spreaders. So, the social fabric has not come out stronger with the COVID-19 pandemic, although you have seen incredible, individual efforts, and civil society in India has really risen to it. But one of the things of the pandemic that we've seen, not just in India, but in many places, is the questioning of this neoliberal order. In Lebanon, you had the ultimate case where there was no state, there was private initiative. And what we are seeing with this pandemic is yes, there are ordinary people with incredible resilience and putting together a massive effort, but the state has not, matched expectations, really.
Not matched expectations. There was a comparison done, Pradeep Singh, by the Financial Times, showing the countries that have been hardest hit economically among low-income nations. India was second on the list. This is in this Monday's edition, behind Peru. Other countries fared better, like Vietnam, and what they pointed to was a bureaucracy that is more nimble and flexible and able to adapt to a changing situation, which the analysts argue is not the case in India.
Well, when we look at the absolute numbers, obviously, Indian numbers can be very overwhelming, whether we talk of Delhi or of Bombay or at the all India level. But the fact of the matter is that we are 1.4 billion people, as we all know, and with a very high level of density. So among the major countries, it is one of the densest populated countries with a density of something like 460 people per square kilometer. So in any case, social distancing is extremely difficult. That is number one. Number two is that we tend to criticize India compared to Peru or Vietnam. But the fact is, we should compare Indian numbers vis-a-vis 1.4 billion population mark.
This map is the slowdown in the economy.
Correct. I'll come to that. We'll talk about the economy as well. Right
Sure.
now, what I'm saying is that if you compare 1.4 billion population impact of COVID, there are only three regions that we can think of. Either we compare it with China, 1.4 plus billion people, but then China is not a free information flowing country, so let's keep that aside. But what I looked at was that, look, if you take the whole European population, the whole North American population, Japan, Australia, etc., you take this developed bloc population, which is nearly 1.4 billion people, then you see that India actually has done very well. Because for 1.4 billion people, India's cases are 4.1 million, against 11 million in this block that I told you. Okay? If you look at the deaths, India's deaths are 72,000 or counting. Okay? Whereas in this block that I told you just now, there are 480,000, so it's 6.5 times more.
Of course, one caveat in all of that is the fact that where the data is kept the best is in urban areas, and 2/3 of India's population lives in far away from the big cities. 80% of the doctors are either in cities or suburbs in India.
It's true. But at the same time, because I do have doctors in the family who are also working for the government and in the private sector, they are spread in the cities and in the rural areas. And basically,
And what are they telling you about the rural areas?
I'm coming to that. So basically what they are saying is that there has been tremendous amount of effort from the government to bring the medical facilities as much as could be allowed by the public health system that we have in India, which is not at the level of France or Germany or whatever. It's not so well developed. But even then, in last few months, the government has brought a lot of facilities to the rural areas as well. And it's very interesting to know that few months back, there were very few ICU beds. Today, there are 96,000 ICU beds in India. Okay? Then we were producing zero personal protection equipment before the thing started. Now they are making 300,000 PPE per day. Okay, and this is being exported as well. Then in the very beginning, even though this famous medicine hydroxychloroquine, right? India exported to 100 countries. Despite having the need within back home, they exported to 100 countries. So I think India has done as much as it could have, with the fatality rate being at 1.7% against the world average of 3.5%. So it's to be commended. And the recovery rate has gone to 77%, which is at the overall level of the country. I'm not talking Delhi or Bombay.
Siddharth Bhatia, you agree?
I thought that basically we were heading towards talking about the economy. So yes, the number of deaths we are number 3 now. I'm not so sure whether, I don't want to get into a semantic argument, but I'm not so sure that 1.4 billion ranging from Australia, Japan to the United States is the same as one landmass. But that apart, what I'm saying is that we have some issues about the figures. I think Dr. Lakshminarayan might be able to enlighten us. Issues about figures from rural areas. There is a fair amount, I know in Mumbai, certainly, fair amount of people who are not revealing themselves. So I don't think the quibble here is about whether India is doing better or not and all that. This is a situation on the ground. And as far as if at all, the economy question is also put to me, my only point is that the economy is in a rattled and, shall I say, shattered state, because quarter on quarter we've reported 24% down.
We're going to talk about, Siddharth, we're going to talk about the economy. But before we do, I just want to go over this point that Leela alluded to earlier. Mumbai is home to the world's largest slum. Back in July, it earned praise the world over for containing COVID with food and water distributions. There was toilet sanitation 3 times a day in Dharavi, which avoided the worst back then. Now, what happens next? Is there going to be, I guess you could call it rising expectations that, well, this is the kind of standard that Dharavi is going to want henceforth?
Definitely, definitely. I think that's a very, very good way of looking at it. There has to be, in fact, there's going to be rising expectations in this city about housing, about public housing, about Dharavi has been a perpetual kind of test case for trying out various kinds of methods to build better housing. They've all collapsed, not gone anywhere. But the people of Dharavi now, certainly more than ever, there was always political awareness and social awareness. Now, certainly more than ever, they will demand rights, as they should. And I don't know how the policymakers of the city and country will respond, but they have to respond because, this Dharavi thing has not, I mean, the municipal corporation has done a spectacular job. There is no question about it. I've been talking to people there. Very good job. But the people have participated, and the civil society here, as Leela pointed out, has just so risen to the occasion from the time of the migrants crisis. I know people have been working non-stop in the field. So I think why Dharavi? There are several other slum pockets. 40% lives in slums. They're going to demand better conditions, sanitation, cleanliness, etc., as they should. I think that is very good way of looking at it.
So how India reorganizes itself, we're going to talk about it when we come back. You're watching the France 24 debate. Welcome back, or welcome if you're just joining us. It's the France 24 debate, and we're looking how India is going to come out of this COVID crisis. The number of cases there has leapfrogged that of Brazil into second place in the world. With us to talk about it is from Mumbai, Siddharth Bhatia, founding editor of TheWire.in, France24.com senior editor Leela Jacinto, Pradeep Singh, commentator, supporter of the ruling BJP party. And we're pleased to welcome for part two of our discussion from the capital, New Delhi, Ramanan Laxmanarayan, founder and director of the Center for Disease Dynamics. Thanks for joining our conversation. We talked in part one, Ramanan, about how the number of recorded cases rising, whether it's what's to be expected in a country that's got such a huge population, or whether India could have done better.
Well, I think it was to be expected given the huge population, but the lockdown did delay the time at which these cases have occurred. Without these initial lockdowns, these cases would have happened about 3 or 4 months ago. Much of what India needed to do to prepare for COVID should have happened, years, if not decades ago. But when COVID finally hit, India's public health infrastructure was found to be underinvested and wanting. And, frankly, beyond a point, the capacity doesn't exist in most states to be able to test and track and contain in the way that was possible in Western Europe and other parts of the world.
And just before the break, we were talking about the fact how in places like Mumbai's largest slum, local authorities, civil society went in, they got food there, they were able to contain a big success story, but now you're going to have rising expectations when it comes to standards, when it comes to sanitary conditions and the like. How is India going to be different in your view, Doctor?
Well, I don't think India is going to be any different than most developing countries. In fact, it's not actually true that India has a lower mortality, sort of a story that's now being told. India is just about average for all these predictors. It is about the level of infections that you would expect for a country of its size as measured by infections per million population. Similarly for mortality, which is about 52 per million, which ranks about 83rd or 85th in the world at this point in time. And the disease is only about now getting started and moving into rural India in a big way. And rural India is where 2/3 of the country's population lives. And the healthcare facilities there are abysmal. So we're about to see a lot more of this in the coming weeks and months.
And we're seeing, we talked about it in part one, in places like the Dharavi slum, is there now herd immunity?
Well, there is, I guess the right term should really be population immunity. But yes, the disease has swept through many parts of urban India. There was recently a survey, a seroprevalence survey from the Tata Institute, which showed 58% of slum dwellers in Mumbai had already been exposed to the virus, which certainly puts them within striking range of population immunity. This is true in many pockets in India, especially in urban slum pockets, but certainly the exposure is not nearly as high in other parts of India, and they will eventually catch up. But at this point, the virus is spreading completely uncontrolled.
Completely uncontrolled, and yet we've, again, repeat this mantra, it's about lives and livelihoods. There's no choice but to reopen after such a long lockdown. And we witnessed it this Monday in places like the capital where you are, but also in other major cities, what with at least partial metro service coming back. Yinko Yitade has more.
If you were to go on the metro in New Delhi today, you will need to be frisked by a metal detector, get your temperature checked, hand sanitized, and your belongings disinfected. Authorities are taking no chances on the Delhi metro's reopening after a 5-month shutdown amid fears of the spread of COVID-19.
दिन से लगभग 4 to 5 months से हम वर्क फ्रॉम हो गए. अभी फर्स्ट डे मेट्रो का फर्स्ट डे तो अच्छा लग रहा है. अभी आगे क्या होगा, अब फ्यूचर में क्या होगा वो तो हम बता नहीं सकते.
However, the metro's reopening has been tainted by the country's new coronavirus milestone. With a record 90,802 new cases, India has now surpassed Brazil. It stands as the second worst affected country in the world. Experts are now calling on people to do more to curb the spread.
It's nothing to be, really proud of that we are second. I think we are not taking all the precautions. We are not maintaining all the decorums and we are not following all the instruction given by the government.
Some 4.2 million people now have coronavirus in India. The surge in cases has mostly come from 5 states: Andhra Pradesh, Tamil Nadu, Karnataka, Maharashtra, and Uttar Pradesh. To add to the country's woes, India's economy shrunk by nearly 24% in the last quarter. This the product of what experts say was the strictest lockdown in the world. Restrictions put in place by the government meant millions lost their jobs instantly. With lockdown measures now easing, many fear India's coronavirus crisis will only escalate.
Jacinto, so the metro reopening in a lot of places, however, not in Maharashtra state in Mumbai.
Yes, I mean, this is another, feature of the coronavirus pandemic, because there is a central government in the capital and there are the state governments. So there's also the question of coordination. Once again, this is a huge country, but a lot of the implementation had to be done by the state. And at sometimes you could even see a sort of a competition between state governments, So there were some state governments that did very well initially, Kerala. That is another thing that going into the future we need to look about. But what Dr. Lakshmi Narayan said was extremely true. I mean, what we are seeing in the pandemic, not just in India, but across the world, is basically an acceleration of old patterns. The fact that public health, especially in the rural areas, was overlooked. What's going to happen now is you will probably have people from the villages trying to get to the nearest city, trying to get into the capital. And then once again, we will have, even in cities that have better healthcare provisions, there will be a strain on this. So the spread is, once again, let's not forget this massive outflux of migrant laborers that went from the urban areas into the rural areas, because the lockdown was extremely hastily implemented with very little contingency planning. And so you have the vast labor force going into villages.
So you're saying it's going to get worse before it gets better?
I think so. And also in the rural areas, I'm really not a statistician, but how many of these suspected cases would be counted? What's going to be the effect on for other diseases? Given that the public health system is so strained, and Indians have relied overwhelmingly on private healthcare, which they have. There's no real social security. So, there's a fallout of other existing conditions and what is going to be the level of healthcare available.
And that brings us to that question we asked at the end of part one, which is, Pradeep Singh, are people going forward now going to expect more from their government? At the same time, less red tape, but more government intervention, both in the healthcare sector, but also in the overall economy?
I think that's true. Certainly in the health sector, there is no doubt, and there have been a host of announcements by the government in terms of creating more hospitals, creating insurance for the healthcare workers, increasing beds, as we said, planning to increase the vaccine production in India. Currently, we produce about 145 million doses per month of vaccine. The plan is to increase it to 300 million doses of vaccine in next few months, of course. So a lot of work is going on, and the healthcare budget has to be necessarily increased. And there have already been quite a bit of inputs by the government to do that.
And is traffic have to be run more by New Delhi? Does New Delhi have to get more involved in what's going on at the state level, as we heard Dr. Laxminarayan describe how we could see the disease now spreading to rural areas much more?
Well, in many ways, because India is a federal structure, so a lot of activities are actually taken care of by the states. So therefore, the center or the federal government does provide a lot of funds, but the actual execution of these schemes largely has to be done by the states. And some of the states actually are taking up the challenge, and there is no other option but for the states to carry it forward.
So, Siddharth Bhatia, no major change in the way India is run?
No, I think there'll be some impact. I think in the political economy sense, there'll be some impact. The states have been complaining that they've been left to their own devices, but a lot of back taxes owed to them have not come. I think they are going to now demand, a fairer deal. But my sense is, politically speaking, my sense is that each state is going to say, look, you can't bank beyond a point on the central government. It's up to us to do it. And wherever in cities and small towns, when there is a municipal corporation and a local civic, organization, and these are all elected mostly, they are going to be under tremendous pressure to perform. So I think I see some devolution, because right from the beginning, the Prime Minister himself kept on saying, well, it's up to the states. And ultimately, I think some states are going to react really well and build. You've seen in certain parts of India, especially in the cities and in smaller places, where makeshift beds, etc., have come up. So I think they have to look at some kind of state and local civic involvement in setting up these things, because India's healthcare has been just run by the private sector, which now it has become even more clear is only interested in profits. And we've been very proud that we have got all these world-class hospitals, but they are running only for the money. So I see pressure now to say, please, let's start investing in health in a big way.
Dr. Laxminarayan, are you seeing, let me bring in Dr. Laxminarayan on this. Are you seeing a new view, a fresh eye when it comes to not just healthcare, but public healthcare?
I wish I could say that I'm seeing that, but I could totally see a future where things just went back to the way they were and there wasn't really much of a change. It's too early to tell. This particular pandemic has really challenged India in ways that it has never been challenged before by a public health emergency. Previously, whether it's HIV or whatever else it was, there was always time to prepare. And this time, there was absolutely no time to prepare. I have to say, in fairness, that the response has been what was possible under the circumstances. The level of messaging, right from the very top politically and from various states to take it seriously has been pretty good. And people have had to play the balance between not sending people into cold panic about the virus, but at the same time communicating the seriousness of the situation so that people would comply with masking and social distancing and so forth. But the hard work of public health has nothing to do with medicine, doesn't have to do with vaccine. It has to do with clean water, with sanitation, with having clean air. And these are big investments and challenges which I fear will be lost once this pandemic is over. And it will just be about building some hospitals and so forth. But public health is a lot more than that. And I don't think that there's still a strong political understanding of what public health entails. And I have to also say that, maybe the population is not yet at a place where it knows that this is what it really demands. There is a population demand for healthcare, which is if people fall sick, they want to go to a good hospital, but not yet one where they demand that public health work and they not get infectious diseases or chronic diseases, as may be the case.
And you mentioned there how right now things might be a little bit different. In part one of our discussion, Siddharth Bhatia mentioning how where he is in Mumbai, anecdotal, but when he went to markets, some people were wearing the mask, others weren't. Are people social distancing as much as they can where you are in the capital? And what's the mood been like? Are people courteous? Are they on edge?
Well, I think people are definitely tired of COVID and the mask wearing. I think this is true across the world, so India is not an exception in that sense. Recently I traveled to Uttarakhand, which is a state which is up north, and there's vast differences across states in the level of compliance. I was driving through Uttar Pradesh, India's most populous state, and very little mask wearing. In fact, I should say practically no mask wearing I saw. Whereas Uttarakhand was fairly compliant, in fact, far more compliant than even Delhi, which is reasonably compliant, not as bad as Uttar Pradesh. So there are significant state-level differences, which again come back to lots of things about the education, the level of communication from above in terms of how to take this, how seriously to take this. There's a lot of difference, and that's why you'll see when all this is done and dusted, that different states in India would have performed extremely differently. The southern states have managed to gear up quite well. They've done contact tracing to amazing levels, really beyond what many developed countries have done, in fact. But there are other parts of the country which just won't fare that well because they just never had the public health infrastructure to begin with.
Never had it, but now the demand for government, in this case, is back. And it's not just India, it's around the world. Pradeep Singh, with a prime minister who was for reducing the role of government, at least when he was first elected. Is it going to be a 180-degree turn now?
Well, it is happening by sectors. In the health sector, of course, the private sector has to be brought in. There is going to be increased government and private sector participation to provide adequate medical services. So this is one step of which the government is aware, and this is going to happen. Other one, and therefore the overall health spend in the country has to increase because, as other people said, the expectation of people for a good quality health service is increasing, and they would demand that.
Rising expectations, Jacinta.
Rising expectations, but what is very characteristic of what we have seen now is how the policy was so directed at the middle class. The lockdown was imposed in a way that the middle classes could manage it with no foresight into how the vast majority of India's population will live. You will see also, I predict, in the weeks and months to come, some sort of health diplomacy. India has a vast pharmaceutical industry. China is also embarking on a health diplomacy. So we will have private sector coming up with vaccinations. But the whole issue of distribution, of equitable distribution. I kind of agree that this will really not this will not be on the agenda. Once again, the middle classes, the growing economy will take the center stage, and the basic problem, which is India's vast population, which has not been served, will be overlooked. And another thing is also, the social fabric. And actually, Siddharth Bhate would be far, in a better state to address this. But it's also the narrative. How much of the narrative of the failures can be covered by the press? How much can be discussed without, the media facing defamation lawsuits or criminal lawsuits, So what is the freedom that this pandemic is can we address this?
All right, let me put it to Siddharth, and this will be the final question. Siddharth, has there been censorship or self-censorship when it comes to coverage of this pandemic?
No, in fact, I would say there's no censorship at all, nothing formal anyway. And self-censorship, if at all it is there, it is at the level of managements and editors rather than journalists. But I can tell you that there is no need for self-censorship. There is no need for pressure because vast amounts of influential media platforms, print and television, have so happily joined the Rara Brigade, and they've done it by simply doing one thing, by simply ignoring the real issues. I mean, there's hardly any serious COVID coverage now, hardly. And they're all the television channels are obsessed with some film star who has died, accidentally. All they're chasing those kind of stories. So there is no censorship, but there is no media. And there is no journalism. So where is the question? I mean, so all these debates that we are talking about are happening in a very small pool, and they are not reaching the general population. So the general population could well be lulled into thinking all is really well, and that everything has been managed extremely well. The 4 million number is not coming out on a daily basis in any kind of hard-hitting way.
Right, so that's
we are in a very surreal situation as far as the media is concerned in this country.
All right, so it's certainly a strong statement there, one that primes the pump for another conversation. We'll have to have it very soon. I want to thank you, Siddharth Bhatia, for joining us from Mumbai. I want to thank Dr. Ramanan Laxminarayan for being with us from the capital, New Delhi. Pradeep Singh, Leela Jacinto, stay with us. Media Watch is next. And it's time for Media Watch. Let's say hello to Catalina Marchant.
Hello, Francois.
So we're talking about India leapfrogging Brazil into second place for number of confirmed cases of COVID.
Exactly. India has indeed surpassed Brazil with the world's second highest amount of cases, with 4 million cases. 4 million cases. However, even though they have surpassed Brazil, the Brazilian president still doesn't seem to be setting an example for the country as it celebrates its Independence Day today. This is the first 7th of September that is being celebrated without an official parade since the military dictatorship, since it was canceled back in August due to coronavirus. So it's been changed to, if you will, a small gathering in front of the presidential palace.
And that picture is from today?
That picture is from today, and it is a gathering where supporters were able to greet the president,
Who's not wearing a mask.
who is indeed not wearing a mask. So here you could see the president entering the gathering in a car with children not wearing masks. As you can see, there are just 2 children wearing a mask. This is indeed astonishing behavior, considering that himself, he had corona. He had tested positive for the virus back in July. This is the picture we saw before, with obviously social distancing measures not being respected. As you can see, people also not wearing the mask, and also more disregard to social distancing measures as the First Lady is greeting people by the hand. So obviously no coronavirus protocol.
And this has caused a stir in Brazil.
It's obviously caused a stir in Brazil, but people are used to this by now, because these are images that we continue seeing. As even you yourself, you asked if this was today, because these images are not new to us. So
all right. Shocked but not surprised.
Shocked but not surprised. From
Catalina Marchant, I want to thank you. I want to thank our panel.
Two comments.
Very briefly.
Very briefly. So one is, this is in contrast to what we have seen in Brazil. India's Prime Minister, from day one, when he addressed the nation, he talked about masks, and he himself was keeping a mask. He talked about social distancing, and he talked about washing hands. That is number one. Secondly, talking about the media in India, which Siddharth talked about, is, look, nearly most of the media in India is privately owned, and they are governed by their TRP ratings. So they are concerned more about the profits, whereas the government channel is different.
All right. We'll leave it there. You got the final word.
Sort of.
Pradeep Singh, I want to thank you. I want to thank you, Catalina. Thank you for joining us here in the France 24 debate.